This is a study showing the overlap technique using the positive and negative images in order to produce a three-dimensional image. Here we see the photographic positive image of the shroud face, which conveys the appearance that we see on the shroud. This is photographically enhanced so that this is rather much darker and see more detail than on the unenhanced shroud. Next we will show the photographic negative. Here we see the photographic negative, which gives the a positive image. The blood stains on this image are light as compared to the dark color, and which of course the red color on the shroud itself. We will now project the positive and negative images directly on top of one another. Here we see the two images projected directly on top of one another. We can see some highlights here. In just a moment, we will throw the two images slightly out of register. We will drop the negative image somewhat and watch carefully the effect on the appearance of the shroud face. Thus we see the rather remarkable emergence of a three-dimensional image here. We would like to point out some of the features which are enhanced on the three-dimensional image, making other findings much clearer. We can see here the coin images over the eyes much more clearly now, but we will zoom in some in order to appreciate these more fully. Here we see the area over the left eye here, and here's the coin area over the right eye right at this point. Through other studies we were able to identify both these coins as Pontius Pilate, Lepta, or the widow's mites. Here is another fascinating and important finding that we can see enhanced in this image. Here on the forehead is this box right here. Actually we can see lines extending out two sides from it and the V down here. We've identified this as a desecrated Jewish phylactery. We will zoom in on this some more in order to see it more fully. Here we see the box of the phylactery. This is a small leather box. The front of it has been torn down. This is what constitutes the V hanging down here. And here in this area we can see these small bean-shaped places, which are the small compartments from which the parchments in the phylactery had fallen out. We will look at some of the other features here as well. Other features which are enhanced by this technique include the flower images that we see off to the side. Here we will zoom in on these. Here we see the image of the flower. This is the first one we detected. Here this is an image of a chrysanthemum that we see right at that point. Here is the center of the flower right here, and here we see the petals arranged around it. As we look in other areas, we again see a number of structures here which are enhanced by this technique. Here we are looking at another flower image right here. This is a scabiosa flower. Here we can see actually the stamen of the flower and the petals around it and the stem going down here. On the other side we can Again, notice that many of the irregularities here are actually flower patterns. Here we see a pistachia flower. These are the small little berries on it, and here we see the stalks here. Here we can see at this point a flower structure as well. I'll zoom in on somewhat more closely, where we can see the structure around here, which is the Rodolphia plant. We can see the tiny little florets around there. And most important is a structure that we see off to the actually the anatomic right shoulder. We can see here a structure and some heavy stalks coming now from this. What we have here actually is part of the image of the crown of thorns sitting on the right shoulder. Here we can identify the thorn here, which is the Gandelia thorn, and these are the heavy stalks coming from it, so that the entire crown of thorns been put on the right shoulder, and the three-dimensional technique that we're seeing here helps to enhance the image of that and the appearance and identification of it. We will once again rotate the image to overlap and then out again, so that the three-dimensional appearance can be better appreciated. Here we'll be doing a study using a technique of overlapping the positive and negative images on the shroud. Here we are seeing the positive image of the hands over the lower abdomen, and the positive image actually is a photographic negative, whereas that the image on the shroud has the qualities of a photographic negative. We will then shift to the negative image, which shows the positive. Here we see the same area in the photographic negative, and we can see the positive image. Here we see the hands overlaid. That's that we see here the left hand over top of the right hand, and the bright area, which is actually the blood stain in the side of the puncture wound, we can see in the left wrist. We will next project the positive and negative images directly on top of one another. Here we see the combined images, is that the one projected directly on top of the other. What we will do next is to throw the two images very slightly out of register. That's that we will lower one of them so they're very slightly out of register, and observe the effect on the image. As we see, as the two images are thrown very slightly out of register, we can notice a rather remarkable three-dimensional effect that occurs with this. We will zoom in more closely to observe some of these findings. Here's the blood stain. Here we see the fingers of the left hand here, the fingers of the right hand here, and we'll notice this peculiar situation where we notice what appear to be the bony structures of the hand itself, or the metacarpals, on the image. And here at this area, we see what appears to be the possibly the carpals, or the bones of the wrist at this point. Here again in the center is the puncture exit site on the back of the hand. The nail, of course, was put through the palm and exited on the back side here. And this would be the wrist area right at this point. We will rotate the image in and out of register again so that the three-dimensional effect can be seen. Here we are making a comparison between the three-dimensional images of the hands on the shroud compared with hands in a similar position, so that we can get an idea of where the various structures are. The alignment is not quite perfect here, and of course there are variations in the size of the hands. Here, as we rotate back and forth, we can notice the overlay here. We'll zoom in more closely. So here we look at the anatomic right hand here. We can see the finger structures. We can see the knuckles at this point, which do not quite match up with the actual hand here. But we can see the apparent structure on the shroud image of the metacarpals at this point. Focus up on the left hand of the shroud here. We can notice the first in the center of the picture here, the nail wound and the blood flows around it at this point. We can see where this would tend to correspond with the actual hand here. And looking at focusing on the left hand here, you see the wrist, the forearm here, the wrist, the hand itself, and the fingers here. We will zoom in more closely on the fingers here. You'll notice a rather striking similarity between the image on the shroud and the actual fingers here. You see that the knuckles on this side match up more accurately with what we see on the hand. Here we feel that the thumb is actually locked left thumb is locked under the right wrist, so we see very little of the thumb except the base of it here. Focusing particularly on the wrist area or the metacarpals here, we can notice where these would lie, and the relationship of the wound, which we would see actually emerging on the back of the hand here in the wrist area. So thus we see that the structure of the hands that we see on the shroud here rather closely matches the actual anatomic hands, except that astonishingly we see what appear to be the bony structures of the hand and the wrist on the shroud as well. Here we see an overlap by the polarized image overlay technique showing the x-ray of the hands compared with the photograph of the hands. These are both my hands as well as the x-ray of my hands here, so that they would obviously the same structures, although they're in slightly different positions since they were taken at different times. But we can see how the structures would overlap. Zooming in more closely, we can see the fingers, particularly in the right hand here, are not in the same position, so we see the knuckles and the metacarpals, or the bones in the hand, are quite dissimilar. In the overlapping left hand here, we see a considerably better matchup. However, we go from the x-ray to the hand itself. We can see the knuckles here. It matches up with the metacarpals here. The fingers are similar. We can see the bony structure here, and the bony structure of the wrist and the radius and ulna here. We feel that the thumb is actually locked underneath the right wrist at this point, and that we see just the proximal, or the base of the thumb here. This is a demonstration of a finding of the hands folded across the abdomen compared with an x-ray of hands. What we are seeing now is a three-dimensional image created by a superimposition of the positive and negative images and throwing them very slightly out of register. We see considerably more detail at this point, although there are some artifacts that are introduced by this procedure. We here are looking at the left hand over top of the right hand. This is compared with an x-ray, as we see here, of hands in a similar position, although the position is not 100% identical. We are going to rotate back and forth to show the comparison. The the alignment is not quite the same, so that there, of course, is not a complete match-up between these by any means. As we go back and forth, we will notice that on the shroud image we see here, that the fingers appear to be very long. We feel that the reason for this is that the bony structure is apparent on the shroud. By comparison here, we can see that the knuckles can be seen, the bones in the hand, and we will focus in on the wrist bones in a short period of time. We will focus in more closely so we can see the comparison, but as we rotate back and forth here, you can see that the metacarpals, or the bones that are actually within the palm of the hand, very closely parallel the images that we see on the shroud. We will focus in more closely in order to demonstrate these structures. Here we see the fingers extending here, and they closely parallel the structure we see on the X-ray. The fifth finger here is largely obscured actually by the presence of a folded cloth, so that we see only the proximal portion of the most lateral, or the fifth metacarpal here. Focusing over to the left hand here, we again can see the knuckles visible on the shroud here, and as we will focus in more carefully, we can see that this matches up rather closely with what we see on the X-ray of the hand in a similar position. Here we see the thumb, which I feel is actually locked underneath the right forearm in order to hold the hand in the position, and that we may be seeing the proximal part of the thumb there as well. To focus in more closely, here moving from the fifth metacarpal, the fourth, third, second, and here the first in the thumb. Of particular interest are these structures here that we see on the shroud. Here in the center of the image is the wound of the nail with the bloodstains from it. As far as we can tell, the wound was actually in the proximal part here on the left, in the lower part of the wound where the nail actually went through. We will now rotate so we see the X-ray here, where we can see the carpal bones here. As we rotate back and forth, while the match is by no means exact, we do see an interesting collection of two lines of small structures here on the shroud. As we rotate back and forth, we'll notice that these have some similarity to the carpal bones in the wrist. We would need to recognize that there is a half-inch spike going through the wrist apparently at this point. While it appears as though the wound is actually over the distal part of the radius here, I feel that the exit wound was through which we would see the blood coming from, of course, is in the back of the hand, and that the nail was put through from the palm side at an angle here, so that we feel that it would be separating some of the carpal bones, which we may be seeing in the center of the image here. This, of course, would possibly cause some displacement of the carpal bones without necessarily breaking them. Or that, simply these are, there are, of course, are considerable anatomic variations in size and shape of the hands and the bony structure that individuals have. So thus we see a very interesting a view here, where it is apparent that the bony structure of the hands on the shroud is apparent on the image. The explanation of this would, of course, be rather difficult to explain in terms that we ordinarily know here. And we see apparently not only the fingers, but as we look at the wrist here, is certainly suggestive that we may be seeing the carpal bones or the wrist bones at this place on the shroud image as well. This is to document the comparison of the x-rays of the hands with the hands on the shroud, which we see here. So we see the left hand over top of the right, and we feel that the thumb of the left hand is locked behind the right wrist. Zooming in more closely, we can see the structures of the bones in the wrist here, and here, interestingly, on the shroud image, we see what appear to be the bony structures on the shroud image itself. We notice, as we zoom in, here in the center of the picture, the area of the exit of the nail wound and the blood stains from that. Below that, we see what appears possibly to be the carpal bones, or the bones of the wrist, the bones of the hand, or the metacarpals, and then the phalanges, or the fingers here. For comparison, here is the x-ray of the same area in a similar type of pose. Here we have a demonstration of the comparison of the image on the shroud with the hand's approximate position that we see on the shroud, and the x-rays to indicate the bony structures in that. We see that the left hand is over the right, that we feel that the left thumb is locked behind the right wrist in order to uphold the hands in the position that we see here. And that we see on the x-rays is that the metacarpals, or the bones in the hand, apparently are visible also on the three-dimensional image that we see of the shroud hands. This is another demonstration of the comparison of the shroud face, which is overlaid by a X-ray of a skull. Here, thus that we can see the general overlay at this point. We can notice several fascinating things. Thus that for instance, the orbits of the eye fit very well with what we see on the shroud. We will zoom in more closely here. You see the orbits of the eye here. The supraorbital lines that we see right here match up quite well with the shroud. We notice the rounded areas down here, which can match up with the inferior orbital ridge here. And the lateral one fits very well here as well. Here we see in the nose the nasal bone here, and the septum of the nose actually shows up at that point. We do see here where the nasal cavity would enter in, that there is a break here, which has been interpreted as probably the point of dislocation. Looking down more carefully, we notice the dark areas in the cheeks here, which interestingly coincide rather well with the maxillary sinuses that we see right at this point. Dropping down to the mouth area, you notice here the mandible and the lower teeth and the upper teeth at this point. We notice that just the overall appearance here that this fits, the dental arch fits in rather well here, as well as the jaw at this point. We will focus in more carefully on the teeth here, which we see even at this distance here on the shroud, these vertical lines in this area where the teeth are, but we will zoom in more closely on this in order to observe this in detail. Here we see on the skull the appearance of the teeth, and as we turn to the shroud, we see these multiple vertical lines here, which actually match up with this rather astonishing way. Here we see on the shroud that these vertical lines extend up here, which is very similar to the roots of the teeth that we see here. On the lower teeth here, again, we notice on the shroud here the vertical lines at this point, and we notice that these correspond rather strikingly, although certainly they are fuzzy on the shroud, but that we do see a number of vertical lines here, which would be in the same position, and would correspond with the approximate length that we would expect to see on the teeth. We can notice the part of the tooth which is above the gum line at this point, and the narrower tapering root that we see down here, and this is very similar to what we see on the shroud at this point. This is the wider image up here, which narrows down and been tapering way down to about this point, which is the approximate depth of the tooth roots that we see on the shroud. Thus we see, again, rather striking appearance of the similarity that many of the features on the shroud face have with the X-ray appearance of a skull, suggesting that an X-ray process is involved in some way in the formation of the shroud image, although the shroud still apparently has flesh on it, and we are seeing some type of X-ray appearance of the underlying bony structures on the shroud itself. Here is the same image treated in a different way by putting a green filter in front of the image of the skull, so that the differentiation between the shroud image and the skull image can be more readily appreciated. Zoom in more closely to see how the outline of the skull fits the orbits of the eye, the cheekbones, the nasal bones, and particularly the teeth at this point. I'll zoom in more fully on this. Where we can see it rotate back and forth, turns to the skull, shifting back to that on the shroud. Noting the how deep the root structures go in the skull here, and noting that when we shift back to the shroud image itself, that the vertical lines follow this very remarkably. And as we see the appearance of the skull directly on, with the teeth going backward and overlapping, we get rather astonishing similarity to what we see on the shroud. Moving back out to show the similarity of the image that we see on the shroud, albeit much more vague and partial, to what we see on the skull. Notice the rather striking similarity to the highlights on the shroud that we see to those on the skull. Here we are doing a comparison between the teeth on the radiological appearance of the teeth on the skull and the shroud. This photograph is the photographic negative, which gives a positive image. We've put a green filter over the skull in order to help differentiate the two structures. Here we see, as we rotate back and forth, the matchup between the teeth on the radiograph and that we see on the shroud. We will zoom in more closely to look at these structures. And we notice the space between the two and the roots of the teeth that we see here on the skull as they extend upward. And we can see how close we are. We can see actually the individual threads on the shroud, and that these images obviously are not part of the shroud weave itself. We're focusing on the lower teeth now. Here we see on the shroud. Here as we rotate to the skull, we can see how the upper part of the teeth is very prominent, and the roots are tapered down into the jawbone. can see that the width of the dental arch fits in rather nicely with what we see on the shroud.